Good evening, good evening, good evening, and welcome to another Facebook Live here on BlackDoctor.org. I am Ellis Dean, the Director of Digital Programming and Production at BlackDoctor.org, and also one of the many hosts that we have here on our channel. So before we begin, we've got a wonderful show. Let me just go ahead and say that off the rip. We've got a wonderful show for you tonight. But before we begin, what we'd like you to do, let us know where you're watching from. So drop that in the comments. And also, if there is someone that you know that could utilize this information, please tag a friend. Let them know, hey, this is some great information that you need to get. And finally, I need for you to ask questions. If you have some questions for our guests or anything about the topic that we're talking about tonight, please drop that in the comment section so we can get that question answered for you. So tonight we are, it's Dr. Gigi. So y'all already know what it is. This is going to be one of those programs. We've got Auntie Gigi here with us tonight, and she has a special guest with us, and that is Dr. Kendra Outler. And we're going to be talking about breast cancer, and we're going to be talking about a unique aspect of breast cancer because Black women are disproportionately affected by breast cancer, and we have specific types. And so what we're going to be talking about is healthcare disparities as it relates to breast cancer awareness, and what you should be doing in order to make sure that if you do happen to contract breast cancer, the best way to survive it. And so we're excited to have that discussion. We've got some videos for you to watch, and we're really excited to have that. So I'm going to shut up because this show is not about me, because it's called House Call with Dr. Gigi. So Dr. Gigi, how are you doing this evening?
I'm good, Mr. Ellis. And you know what? This particular topic about breast cancer is more than academic. I had breast cancer 15 years ago, and I had missed a bunch of mammograms because I was going through a divorce, which is not an unusual kind of situation, because we know that stress can certainly make illnesses worse. And I personally believe that it played a role in the development of my cancer, but that's a whole other topic. I found my own breast lump, and was lucky enough that I was able to get a mammogram right away, which is not the case for, unfortunately, a lot of Black women. Because I work in a healthcare system and I'm a physician, I use that privilege of mine to be able to navigate my way through. And I'll never forget when I had my biopsy, because my colleague said, "Oh, I don't think it's anything to worry about." And she did the biopsy. She said, "Just let's biopsy it anyway." I only found out a few years ago that she actually knew that it was going to be cancer. So she was kind of just saying that, I guess, to make me not worried. And then I was diagnosed, and she called me up. I was actually in the middle of clinic, believe it or not. So she told me she didn't do it face to face, which I guess is fine. And of course, I burst into tears, not because of me, but because of my parents. To tell your parents something like that, I think that's probably, for me, the most difficult thing. I think the worst thing for any human being is to have something wrong with their child. So I was able to start chemotherapy. Oh, actually, at that time, I did my surgery first, and then the chemotherapy. That's changed now. And I was HER2 positive, so I actually got a year of Herceptin. It had just been approved by the FDA, so I got one IV a week for a whole year. So I'm here to tell you that even though I had 2 large masses, 15 years later, I'm here. And that I am actually an example, even though I'm a physician, of somebody who missed my own mammograms. So I'm really excited to introduce our next guest, because Dr. Kendra, who is an anesthesiologist, is really a woman with a mission, and she's done some incredible work. And so I'd like to see if we can. Oh, I just want to do one shout out. Yes.
Okay.
So my patient, John King, on CNN, he's one of the anchors, announced that he's got multiple sclerosis. I think that took a lot of bravery on his part. He talked about him being immunocompromised. We don't tend to think of a man having multiple sclerosis, but he does. So maybe we can do a show on that. Maybe we can even bring him on because it's such an important topic, and he is not the typical person that we think about as having multiple sclerosis. But without further ado, would like to welcome my friend, Dr. Kendra. So maybe Dr. Kendra, you can introduce yourself.
Hi, Dr. Kendra Outler. The platform calls me Dr. K. So I'm Dr. K. It's hey, Dr. K, and what the doctor say. So that's what we got going on here, and it is my privilege to be and an honor to be with you tonight, Dr. Gigi. I can't thank you so much because this is such a powerful message in terms of breast cancer awareness that we must continue to get out. And so I am an anesthesiologist. I need to give a shout out to my alma maters, which are University of Texas Health Science Center, San Antonio. I trained also at Cook County in Chicago. I'm also a graduate of the Emory School of Public Health. So, so why is this anesthesiologist all about health disparity? And it really is because I grew up and came of age during a time when we were in the fight for HIV and tuberculosis. So if my thesis was on education in urban Atlanta, inner city Atlanta, I worked at Grady Hospital, and so that development of a community needs assessment has always stayed with me. And even though we all know we wear different hats, like this wonderful show you produce, we can balance these things out and live our passion. And one of my passions is health disparity and talking about it. So last year, what I noticed after starting Uzima Health and Wellness is that we got an uptick when October came. It's a big month. I reflected on my experience with a memory of a woman that I knew died of triple negative breast cancer. She was the cook at Agnes Scott College that fed me and kept me fat and family dear to me. And I reflected on that and it really resonated. So I said, this year we're going to come out with something different that resonates to my audience, to underserved people. And I was very blessed to come together with a team and create a video from the heart. And it does stimulate education. It does stimulate conversation. And I think that's the way that we can develop community interventions when it comes to dealing with not just breast cancer, cancer in general, and other health disparity diseases.
So, this is Breast Cancer Awareness Month, October is. And you mentioned, of course, that Black women have higher rates at the outset, Mr. Dean, and as well as higher death rates. And there are many reasons for this. Of course, we know that 80% of all health outcomes are related to what we call the social determinants of health, right? Having to deal with systemic racism on a day-to-day, the food that we eat, the water that we drink, all of these other things. But access to health care, and in a city like Washington, D.C., I will tell you that when we've looked at the cancer, how long does it take for a Black woman to find a breast lump, if it is cancer, get biopsy, and get to treatment? The average for white women is about 3 months. For Black women in DC, it's closer to 9 months. And we know that when it comes to cancer, earlier is better, prevention is best, right?
Yeah.
But I guess my question to you, Dr. Kendra, is, was there a story besides the one that you just shared? Or do you want to tell us more about the woman who's the cook? Because I think when we look at statistics, there's statistics. And what you've done, you sort of with your platform, is you've brought to life these women, these individuals, these families, which is really the way to do it, right?
Right. And no, so, I was going back and I'm a 70s baby. And so I was thinking, no, this is not the only woman. And I think that, being a 70s baby, so everyone knows Soul Train. And I thought about Minnie Riperton. And I remember looking at that Soul Train clip. And you remember, that, just like you started off, that your patient is now sharing that he as a man has MS. I thought about this brave songstress that got on and sung her heart out back down memory lane with the album sitting there, very simple.
Yep.
Must have been 7 or 8 mesmerized. And I had to be in my 20s before I connected that she actually had cancer. And then it was years later when her beautiful daughter, Maya Rudolph, came into our, my comedy space and talked about her mother. And then you connect these things. I thought maybe the first woman that I ever encountered that died young, Black, left 2 kids, a husband, was Minnie Rippleton. And then from there, the lady in the cook, my grandmother, right? And then from there, so now when I hear women say, I have breast cancer, I ask them, what type?
Mm-hmm.
And that has now become the second question, because of course, now do your sisterhood or do your sister talk, you can discuss with them, the type of cancer they have, and then you can help them discuss their management, and then you can talk about the outcomes later. But the idea is that you can now fully engage with the woman who is experiencing breast cancer. And so that's why I thought about Sister Talk, but it is from the beginning of sharing. And I have just counted at least 8 women that I now know, and I will interview someone Friday, Lamar Fund, that is part of a triple negative cancer support group, because she's 50 and she just got diagnosed and she started her cancer journey. And so I'm really excited to present the videos. I'm excited to know that they're resonating, and because it's stimulating a conversation.
Yeah. So, let's just talk about triple negative.
Mm-hmm.
How is that, what is that exactly? Because you hear a lot about it, and you hear statistics about young women who are diagnosed much earlier in the Black community, African-American community, and you hear the word triple negative. What is that exactly?
Well, see, it's only representing about 10 to 20% of all breast cancers. Okay, so it seems like it's a small number, and maybe on the mass scale, it seems irrelevant. But again, I've encountered 8 women, personal friends, who struggled. Some have survived, some have not, with triple negative breast cancer. And again, with Renita, the cook from my school, I said, give me your paperwork. I don't understand why you're not getting better. And she had access to treatment. She had insurance, yes. So she had the mammogram. Why are we not going the right way? So triple negative breast cancer, as I learned and I continue to read about, it is aggressive. Oftentimes you're diagnosed younger, at less than 50, right? And we do see it in largely Black American women or Hispanic women as well as a second group. We don't know genetically if it's just that, but let's say that right now that is the demographics. And really what we're saying is that, cancer is this proliferation of cells. And what we have to think about in terms of treatment is if we can target those cells and slow them down. So what the problem with triple negative breast cancer is that there's no target, because there's no receptor for the chemotherapy to go to. Okay. So we call it hormonally receptive negative genes. So you said you had a HER2 positive, or you had a receptor that we could target with drugs. The problem with triple negative cancer is that there is no target. Okay. And so progesterone receptor negative, it is estrogen negative, and there's the HER2 receptor that is also negative on that cell.
Okay.
And so there are chemotherapy treatments that can stave off the cells, but to exactly say we cure it, for some women, this is not possible.
Mm-hmm. So, one thing I have to tell you, that I have clinic, usually have Tuesday and Friday clinics and others. One of the real problems that we've had during COVID is that there's been sometimes a 2-year delay in women getting mammograms. So, people sometimes are reluctant to get mammograms, or there may be different barriers. And one of the things that I have seen in my practice is that a woman, if she discovers a lump, she goes, the mammogram is negative, or the doctor says, oh, you're too young. That happens not infrequently. Oh, you're only 30 years old. Don't worry about it. It's nothing to worry about. So what do you say to a 30-year-old woman that finds a breast mass?
You know, that is part of eliminating health disparities, is how we communicate with patients. We also say that communication is that thing that never happened. Did you say it? You didn't say it. I thought I said it, but I didn't hear it. And when we are learning in medical school, sometimes the last words that we say to a patient is what they process or have trouble processing. So, our ability to communicate effectively is almost a lifelong process. You should try to get better at it. I think that there are a lot of cultural barriers to communicating with patients, particularly Black women who will meet oftentimes a majority white workforce. I mean, that's just what we meet. We are very lucky or fortunate if we do meet someone of color that can relate and break it down to us. But the point is, and I tell patients, you have to take charge of your health. You have to be empowered. And what we found through community interventions is that once we begin to take messages to the community, beauty shops, barbershops for hypertension, and like I demonstrated in my video, just a casual conversation, just a slip, so this is the time during COVID when or doing any type of stressor, or girlfriend is saying, I'm getting a divorce, or my kids are acting up. Are you taking care of yourself?
Mm-hmm.
Did you get an appointment? Or how about, we go to lunch after your appointment, make that the incentive. So we actually can empower each other, and we should do that. And that's the message in the video, is that we can empower each other, because there's some things that we do need help doing. We all go through trials, and we should try to encourage each other and encourage each other in health, and be okay.
You brought up something that I think is so important for women in general, but women of color in particular. We have so many competing priorities.
Yeah.
Whether it's work, whether we're responsible for multi-generational households, or maybe people are not living with us, but that we are, playing the role of caretaker in some form or fashion. If we're working outside the home, if we are going through a divorce, and then you put on COVID and the mental health part. I mean, I have to tell you today, all of my patients today were talking about their emotional health.
Yes.
And it's because of the isolation. And it's just, then we're going into the winter time. Mm-hmm. We're going to be, the blues that we get, the seasonal affective disorder. So there are so many things, and often we as women, we tend to be last on our own list, right?
Mm-hmm. Yes, we are. And that's what we have. That's why I think that it's so important for us to take advantage and show each other what we call sister love and brother love. And that's why I also created a video with the man in it, because our men are included. And it's everybody. I think it's even, and it crosses racial barriers as well. Okay. You just want to have a circle of friends that want you to be healthy. And that's important. And again, we understand the stressors. The holidays are coming up, and these are real times that's going to be tough. The pressure to get it right. This is our first holiday, potentially as a large family. And the pressure is now back on to do that big meal and what have you. So, I think that we have to take these measured steps to take care of ourselves. We do have to schedule the mammogram. And we also have to be conscious that there are women who have to go to mobile mammography units and source those out for patients that we might encounter. We also need to support hospitals like Mercy Hospital. I understand that is one that serves underserved communities. I'm sure that Howard University Hospital has a mammography center as well. And we need to make sure that this month that we encourage women to get out and schedule their mammography.
Well, I just, this is all great. And I want to say this, Dr. K, that was the first time I've ever heard somebody break down what triple negative breast cancer why it was called triple negative breast cancer. So I want to thank you for that. And we've worked with the many companies and we just say Black women suffer more from triple negative breast cancer, but I never knew why it was called that way. So I want to thank you for, at least from my perspective, and I'm sure some of the audience member may not know, but we did it. But there is one, at least that's watching the note, because she did drop in the comment section that she is battling triple negative breast cancer right now. So I just want to take a moment to say, we're with you here, Shantae. We've got your prayers up, and whatever you need from us, please reach out and we can get you connected to second opinion, whatever you need, let us know and we will get that taken care of for you. The other thing that I want to mention is that somebody had talked about it, I'm glad you touched on it, talked about men are not immune to breast cancer. So when we hear that term breast cancer, we immediately assume it's women. And yes, women are the preponderance of cases. However, men can catch breast cancer. And so we do need to be cognizant of that. I believe we had, I think Beyonce's father was diagnosed with breast cancer at one point. So there's just so many things. You talked about Minnie Riperton. We did a Black History of Health on Minnie Riperton. So you can go to our YouTube page. I'll put the link in the comment section. So if you want to watch that, we did a whole show about Minnie Riperton and her fight with cancer. And so just really excited to be a part of it. So I'd like to get to the first video if you want to set that up for us. And that's the sister talk. You want to set that up for us, Dr. K?
Oh, okay. I thought you had the link.
Oh, we do. No, just tell us about it. We'll play it.
Oh, sorry. Oh, yeah, you do have the link. Okay, good. Just want to make sure you had it on your side. So, Sister Talk, let me just say that the people in that video are very, very special to me. Jay, who comes in, we just met. She's my stylist, and she lost her mother to gastric cancer. And so, she became cognizant of stomach cancer, something very strange. Didn't even understand. And she's an only child. Okay. And so, and her mother was an only child. And so I was able to help her journey through that as a sister. And again, we had just met and she gave me that story. And then Sadana Jackson is one of our premier pediatric hematologist oncologists at the NIH. Her mother was diagnosed with breast cancer years ago in her 40s. It came back last year. And last year she was on our Uzima page celebrating and having a picture very similar to the one we post with her daughters. And she died in July. Okay. And she was a longtime Maryland resident and educator. And then the young lady next to us was a gracious extra who also had experience with cancer in her family. I don't remember, but she's very familiar with it as well. And so they were very passionate about the subject. And so it became very natural and for us to get together and just, play out the scene. And then the most important thing in that is, again, hearing Miss J tell us that not only did she drop off her son, but that she got a mammogram. How's the game?
It was so good. Those fans were marching. Just the energy, the spirit, and friendship.
Really?
Just felt good energy.
Hey, Jay.
Hey, Jay.
How you doing?
Good.
What you do today?
Dropped that boy off at school.
Chooks?
Yes. And then I had to stop and get a mammogram.
You got a mammogram today? You got your breast exam?
Yes.
You got your breast exam.
I got my breast exam in.
That's good.
Was it hurtful?
Ew.
It's important though. My mom passed away from breast cancer, so it's so important that we get our breast exam.
It is.
Just a little bit of pain, but then it's really worth it.
Much.
It's not medical talk, it's sister talk. Something that casual and simple can be life-saving. Go get yourself checked. The CDC recommends that women have their first mammogram at 40 years of age. I had mine at 28 because I felt something and I had a family history. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple negative breast cancer.
How do we do?
I thought it was great.
Beautiful.
You got a second career
Yes.
as an actress. If this is seriously, no, that was good. And what I really liked about the video was it was a natural environment, right? It's not. It's friends encouraging others. So we're talking about having accountability partners, or somebody mentioned that in the comment section, about having an accountability partner to make sure that you're going to go get those mammograms, to make sure you're doing your follow-up, to make sure to get that information, because you're right. The last things when doctors say cancer, you know, people have said their minds go to mush and they don't really pay attention to what's going on. If you have somebody there that's taking note for you, that can get that information, that can encourage you throughout that process. My aunt is a breast cancer survivor, and we celebrate every year on her anniversary of her beating breast cancer. And so it's important to have that support system. And so to see that, to see friends talking about it as part of the everyday conversation, I think it's really important for people to say, okay, we've got to take that stigma off of whispering cancer and talk about it in a real way, so we can, you know, beat these. We've got another person that mentioned during the video, Lamar Fund. She is presently battling triple negative invasive ductal carcinoma.
And I'll be talking with Lamar on Friday. We will be on Facebook Live as well. And what I like about Jake is one of the common barriers about breast cancer and getting the mammogram is that people, oh, it hurts. And for some women it is, because some women do have what we call breasts that are very tender and they hurt. But what we've found is that, you know, just to make it as comfortable, talk to them, but we don't want to disregard that people may find it uncomfortable, but it's a little bit of pain, as Sedona say. And then some women said it didn't bother me at all. But we do have to understand that some women do have very tender breasts.
And what I would say to that, for women that are still getting their period, don't go for the mammogram, you know, right before your period. Go after you've had it, because breast tenderness is quite common right before you come on your cycle. That's number one. I think the other thing is, you know, make sure that where you're getting the mammograms, somebody who's actually just reading mammograms, because there are some places where they may be reading bone x-rays in the morning, mammograms once a week, and, you know, something else, a CT scan. So that's something else. And then I think another thing that I can't emphasize enough, get a second opinion. I think that many people are just, you know, reluctant about seeking a second opinion. If you're not getting the answers that you want, if you're not feeling, you know, comfortable or not heard, get a second opinion. And BlackDoctor.org, you can go on, you know, and find doctors that are recommended, because this is your life. I say that, you know, when you're going shopping, right? How many times do we look at the different outfits and we return, or this and that? We should do at least the same for our health. But I think sometimes, you know, patients feel like they will be insulting the doctor if they get a second opinion. And I say, no. I mean, if your doctor is going to get insulted by getting a second opinion, well, maybe they're not the right one for you, because I encourage patients with, you know, diagnosis such as cancer. But what do you say to that, Dr. K?
Well, I'm going to say that technology is getting better. And I think that, you know, if it's hard to get the first shot, let's make sure that we have a reputable mammography center. Again, we do have to recognize that if you're in rural America or some parts, like you mentioned before to me, like even Anacostia, sometimes it's difficult to get even the first shot, okay? But what we do need to do is source, particularly on my website and yours, places that are reputable mammography center that do good imaging and that also have the ability to do a second imaging process. Because what we're finding is that hopefully with MRI and imaging, that we can either offer that type of as a second confirmatory test, or a stereotactic biopsy availability. And also we're producing more breast surgeons and experts in breast care. And those surgeons can then take the images and put together the pieces. So hopefully we're not wasting valuable time, as you mentioned earlier. Time is of the essence.
I would also say that for women with dense breasts,
yes,
you might also want to ask for an ultrasound. And now there is a technology called a 3-dimensional breast ultrasound. So again, the results of the tests are only as good as as what they are. So if you have a family history, especially of a, mother, daughter, sister, or even first cousin that's got a breast cancer that was before she went through menopause in her 40s or younger, you might want to get something called a 4-view or a diagnostic mammogram, because a regular screening mammogram is only 2 views. Right. And if you have a lump, you must get the 4-view and an ultrasound. So these are some of the things that I think are important to stress.
There is some really great information. I'm just, first of all, I'm marveling by this conversation. So, forgive me by not jumping in, because I'm here along for the ride. I'm in the back seat, just riding along. So we're all good. But there are some wonderful, wonderful comments that are coming from the audience. People are sharing their stories, they're sharing their family stories, and they're really just thankful for us having this discussion. Because I think, in a sense, right, cancer knows no ethnicity, it knows no age group or things like that, but we also know that there are differences, and that's what we talked about in terms of healthcare disparities. And so we have to make sure that we recognize those differences, that we can identify those differences, and that we can overcome them where we can. And so when we're talking about getting a second opinion, when we're talking about the three-dimensional ultrasound, those are things that are typically made available to people that are in a more privileged area. And so, but if you know about it and you could ask about it, the better chance you are to receiving it and receiving that type of care that can save a life. I mean, legitimately save a life. And so let's make sure that we get all the information that we can, whether it's on BlackDoctor.org, or you can go to Dr. K's website that's scrolling along the bottom of the screen there. You can go there as well and find out as much as you can, so you're better equipped to be your own best health advocate.
I also want to jump in and mention genetic testing, because there have actually been some studies that show that African-American women are more likely to proceed with genetic testing. Yes. However, they're less likely to be offered genetic testing. So who would be at risk? Who would be the person that you might consider getting tested? Well, if somebody's very young in the family that has had cancer, that might suggest that there is a genetic abnormality. And it's not just breast cancer. Remember, it could be that people have breast cancer, colon cancer, uterine or ovarian cancer, and prostate cancer. Because breast cancer to women is what prostate cancer is to men, in that they're both glands, right? And so if there are lots of family members that have that, you might consider, even if you don't, have cancer yourself, should I get genetic testing? Because if your genes are positive, you're going to get a different kind of screening. You're not going to get the 2 views. You're going to get the 4-view mammogram, for example. You're going to start maybe getting your screening done not at 45 but at 40, or you might get just like colonoscopies. If somebody's got a history of colon cancer screening, we might start you off at 40 or 35. So the genetics are very important. And, I have a friend, Ms. Rhea Blakey, who works at the FDA, and I just want to put a quick plug for this. They have an initiative called the Black Family Cancer Awareness Initiative. Yes. Where they have all kinds of information so that you can ask your family members. As you said, Dr. K, people are going to be around and together again at the holidays. This may be a nice time to ask about things like family history.
And speaking of family history, I have another songstress that talked about her family's history, and that was Patti LaBelle. Yeah. Remember? And she said I used to love her songs and her concerts. And she said at one concert when she sung "If You Ask Me To," yes, she was thinking about her sister who had breast cancer. One of her, and she told the story. I think it's 5 women in the family and 4 of them, and she was sure that by 50 she'd have breast cancer. And so she remembered her last conversation about her sister wanting something that she liked to cook, and so she wrote that song, remembering that if her sister asked her to, she would change her mind, and all she had to do was ask. So I think how we infuse health information through sharing And I think that's our best tool to eliminating health disparities.
I'll also add that many women are not aware of the fact that if they have a very strong family history, there are actually medications that can be given to prevent breast cancer from occurring. That's not often something that is mentioned or discussed.
Correct.
And so that is something, you know, when you're going to see the clinician who might be a wonderful nurse practitioner or a physician or whoever it is, and you have these concerns, it probably is a good idea for you to see a specialist.
Right.
So that you can get your question. Think of it as a consultation. You might not be, you know, seeing the cancer specialist but one time, just so that you can, you know, get your questions answered about, do I need genetic testing? Is there something that I can do preventatively? Because there are, right? We know that exercise helps.
Yes.
We know that cutting back on, you know, animal protein and really including more of those, you know, whole foods, meaning vegetables and fruits and whole grains and nuts, and of course reducing processed foods, right? Those are the things that can get us into trouble, those processed foods, right? And fried foods and so forth. Because actually when you fry food, you actually change the oil, or when you are eating those hamburgers that have a little burn on them, you know, on the grill, that actually contains cancer-causing chemicals. And we're not even talking about the water or the air and so forth. Mr. Dean is looking at me. Mr. Ellis, you're looking at me like, oh my God.
So, I hope you show, and I wanted to tell you, since we want to make sure that we remember that pink, some of us do think about pink all the time. And
right.
as for the who was great to share their stories or comments with us, that's why I made the other video, Pink Reflections, because there are some people that have to think about it all day, every day, even past October. And that particularly when we include husbands and the thought of children, which is what I did with the Allens as well, to show that, hey, you know, we went through this and we're still here. And so I think that those videos are also very special. And I hope the audience enjoys them as well.
Do we have that, Alexis? Do we have Pink Reflections so we can go ahead and play that now?
If I was to go to a snazzy affair, I would want the dress to be pink. I enter my home and everything reminds me of her and her fight. From the pink glass to a simple note, there's always a picture to look at, to walk by. I hear her voice going, "Keep going." I pass a pink glass, another picture of a breast cancer fighter. Into the bathroom. Will I choose a pink hat? Or will it be a cute afro wig? I remember asking one of my friends who had cancer, "Do you want to wear a wig?" She said, "No, I don't. I want to live." For some of us, every day is breast cancer awareness. Go get yourself checked. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple-negative breast cancer.
Can I show you something? First of all, Dr. K, I have to tell you, you inspire me by your creativity and your passion and your advocacy, because, you know, everybody doesn't respond in a particular way. And to have as many different voices, especially as a physician, I think it's just so important. And, you know, this is why we need more Black and brown clinicians, because it makes a difference. We know that when there are, guess what? Life expectancy improves, and you're embodying that with every, no, truly. It's a beautiful videos.
Thank you. And I just want to say that, you know, it's everything you talked about, the genetics. The last group was a group of their mom was the one with triple negative breast cancer. So again, those women have to consider their genetics. And then the other women, again, that's so special because, again, I know that they were in fact diagnosed with triple negative breast cancer. So I thank you for showing them as well. And it's everything, like a big summary of what we're talking about. Eliminating health disparities starts with education, communication, awareness, and just continuing to engage the medical community. Because, the demographics of the medical community, we can't change. We can't change some of the determinants of health, our race, how we age, and where we grow up. But what we can do, and that's what we want to focus on, we can become more educated, we can become more advocate, more of an advocate for our health. And hopefully this will spur better policy and it will spur changes in our communities, one step at a time.
So can I just tell you, look at what I found on my record player, because I still have a record player. So Minnie Ripperton.
Yay.
And Minnie Ripperton. Yeah.
Yay.
Yeah. I do want to say
can you hit the notes?
Oh, yes. Oh, my God. Yes. Are you kidding? I mean, I'm sorry, but this is old school music. We're real musicians. Nothing that's mixed. I mean, what can I say? And you know what? The new generation keeps sampling our music. Am I right? But what I wanted to say in all seriousness, for women who've gotten diagnosed with breast cancer, remember that we're at increased risk for other cancers. So, for example, I've got myself scheduled for a colonoscopy because I have to get mine every 5 years.
Absolutely.
For example.
Well, I want to say that if you have the Allens, they are watching. And let me tell you why this family is so special. They have 3 sons who are in college. And they reflect on that. And this is lets you know that again, when cancer patients go through cancer, and like you were talking about your mom and dad and having to tell them, it's a shared experience. And so that one is very special for that reason. It's a shared experience. So if you have it, I know that they are like rooting for Dr. Gigi, and they're your biggest fan. They told me, oh my goodness, I gotta watch it.
Yeah, well, I mean, an individual doesn't go through an illness. It's the family, it's the community. I mean, it is very tough. And actually, sometimes it can be tougher on the people who are watching. I know that seems kind of, counterintuitive, but if I tell you, I was worried about my mom. I wasn't worried about myself, And I think also we don't talk about the partner, be they male or female.
That's right.
But there's also there can be a lot of fear, especially from men.
Children, and they don't forget.
Yeah.
Do we have that one?
I still
do we have that?
It's been 15 years since you called me that day and said you had breast cancer. I was in total shock.
I know, it's been 15 years. Think, the boys were only 5, 6, and 7 years old.
Yeah, but you were very strong through that whole process, so it made things a little easier on them.
Look at that beautiful cake you brought me. Oh my goodness, thank you so much.
Hey, anything for you is a beautiful cake. Hey, you want to cut it?
Absolutely. No, not with a fork. Let's go get a knife.
For some of us, every day is breast cancer awareness. Go get yourself checked. Early detection of breast cancer can mean a better treatment, better survival. The CDC recommends that women have their first mammogram at 40 years of age. I had mine at 28 because I felt something and I had a family history. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple negative breast cancer.
Wow.
Can I just say they're so beautiful?
They're so well done. I mean, that's a labor of love. I want to again
thank you
push and remind people to go to the website that's scrolling along the bottom of the screen. You can sign up. I believe Dr. K. They can sign up to receive their newsletter. They can watch those same videos. You can share those videos. Do whatever you need to do to get this information out to your friends, families, aunts, cousins, everybody out there. So please go to the website. You can see videos, sign up all of that thing there. And Dr. K say, hey, I got this from Dr. Gigi and Dr. K. We're going to beat triple negative breast cancer in our community.
All right. I just want to thank the show for what it does. I want to thank you for the opportunity to get this public service announcement out. And just thank you for saying that it has been a labor of love. And I think that, you know, one of the things we have to be careful as we become physicians is that we don't get jaded, and that we keep our compassion, and that we understand that there's some of us that there's a some patient out there that still needs you. You know, when you think, no, I can't give anymore, yes, you can. And so again, it's a call to duty. And for the next generation of graduates coming up, we just want to remember, we want them to know that, right, Dr. Gigi? It's a call to duty.
Absolutely. I think, you know, I think in whatever our field is, be us physicians or teachers or, you know, whatever area we're in, it's any area where we're first line and dealing with the public in this current environment, we're getting burnt out. It's very tough. And so I think it's important to always remind ourselves of the higher purpose.
That's right.
Which I think is very important. You know, you said something that I think is very important, and that is our roles, not just as individuals, but as community advocates and activists.
Yes.
So for people who are listening in, I just feel that, you know, you don't have to be a physician, for heaven's sakes. You just have to be somebody that cares about your community, your family, to get the word out. That can be in any setting, right? It can be when you're, you know, just chit-chatting with friends that you don't even necessarily know, when you're going up the elevator, or especially for people, like you said, who are going through a hard time. You know, nobody asked me about my mammogram when I was going through the divorce, because we're the ones that get into trouble, right? So if you see somebody that's having a particularly hard time, maybe just reaching out to them, maybe just calling somebody that you thought about just from this webinar, you might be saving their life, right?
That's simple. That's just that simple. So we got to care about each other. And that's one thing that during this time of COVID has taught us. We've got to care about each other.
And we've got to find different ways, right? We've got to find different ways to get this. If there has been any positive from COVID, is we have really relied on our information sharing vehicles, much like, so our Facebook Live productions have gone up significantly, and that has been able to get that information out and be able to get it shared in a way that's comfortable. Right. And so now when we do go back to the doctors, when we do go back out there, we should be armed with some great information. And so just, you know, one of the shows that we're doing that's going to be right after this program tonight is called Veganish. And what we're doing specifically with that show is helping people incorporate more fruits and vegetables in their diet. And that's important, because we talked about that here tonight, about the diets that help prevent cancer and removing those carcinogens from our diet. Well, we can replace it, because we still need food, right? We still need to be able to eat. And what can we eat that's going to be not only healthy for our bodies, but help prevent some of these illnesses? I'm concerned. I got a history of prostate cancer in my family. I've been getting tested since I was 35 years old. I'm not going to say how old I am now, but it's been a long time. Okay. So
did you know that tomatoes are a particularly good and healthy food to prevent prostate cancer?
Yes. And my aunt, but I learned from Dr. Mac Roach. We did a prostate cancer show. I learned from him, you have to cook them.
Yes.
You can't just eat them raw. You have to cook them. And so there is a diet called the Mediterranean diet that has shown to be effective against prostate cancer. You see, I've been learning. I've been taking my notes. I've been learning. So and so if you've got a significant other, husband, a spouse, anything like that, let them know. If they have a family history of prostate cancer, that look up the Mediterranean diet, and that is something that's supposed to be good in preventing prostate cancer. And there's a program on our YouTube channel that really talks about all of the treatments and things about prostate cancer. We're going to post this. This one's already getting posted up on YouTube as well. Regardless, we're going to share this and play it again tomorrow morning, because this information is sorely needed by our community.
So, you know, one of my patients this afternoon that I saw, asked me a very important question. She is supporting her cousin who's got stage 4 uterine cancer. And she said to me, she said, you've gone through cancer twice. And she goes, I don't know how to support her. I don't know what to do, because I've had people actually avoid me. I don't know if it's because they're worried that what I have is catchy, or they just are uncomfortable and not sure what to say. So what I told her, and maybe we can hear from some of the audience members who are right now dealing with cancer, I told her, why don't you just ask? I mean, I think it's okay to say, you know what, I want to support you, but I want to support you in the way that you want to be supported. What can I do? And I think for me, I got tired of talking about my cancer. I wanted to be distracted from something else. Talk about you and your family, but you know what? Everybody's different.
That's true. That's true.
That's a good question. So if you're watching us now and you know somebody or you've gone through an illness, let us know how you would like to be treated. Do you want to talk about it? Does that help and make it normalize it for you? Or do you don't want to talk about it? Do you want a distraction? What's best for you? And I think that's by sharing it with us, but most importantly, share it with the people that are in your circle. Let them know that they don't need to come over and dressed in black every day. It's not that, if that's not your thing, let them know you want to engage in life as normal. So that's really important to recognize, because that's part of the healing process of feeling normal and not having additional stressors because you're afraid to engage with folks, or folks are afraid to engage with you. So now you're becoming isolated because they don't know how to deal with you. And so I think it's important to recognize that, because our mental health plays a very, very important role in our physical health and how we can survive any of these illnesses that we come into contact with.
I'd also say, if you're going to go visit somebody or you're going to call them on the phone, especially if they're going through active treatment, keep things brief. It takes a lot of energy to talk. And sometimes I thought that I would be able to go for a short walk, when I was feeling better the day before. Don't get upset if somebody cancels, because, first of all, it's very much appreciated. I found personally that getting cards was very nice, because even if I didn't read them, I'm reading some of the cards that I got last year, because it was just so beautiful. So I don't know, what advice would you give, Dr. K, for somebody to support somebody who's going through cancer treatment right now?
Well, I did that with a couple of my friends, and I, got into bed with some magazines. And as I was nodding off with them, and I would hear them, get on the phone. Our phone is always ringing, and they say, "Yeah, she's here. Yeah, she's reading a magazine, or she's taking." And I could hear them, but I just ever so quietly entered into what they had to do, and that was just lay down for the day. Make no demands. And so I think that what you're saying is right. Little things like, can I get you some pineapples? What does because chemotherapy will alter your taste buds. So you have to find that one food that the person can say, I can still taste this. It's the little things. It really is like a card, a picking up of something like stool softener,
Yep.
Sometimes have pain. So those are the things that you can't be embarrassed to ask them. Do you need me to get some stool softener or an enema for you? It's the very little things. And you're right. They don't want to have their whole time taken up, because a lot of the time you're focusing on your own energy and reaffirming thoughts that just get me through the day, God, and tomorrow will take care of itself. So I just think that I agree with you. And as a cancer survivor yourself, I think that you're right on that. All I've been able to do with my friends is support, but ask them, and then get in and get out and give them that space, and know there's always this love, and I'll be back. That's what I tell them. I'll be back.
Yeah. I would also say that sometimes we feel, and I'm a talker, we feel the need to keep talking, and silence is golden. I remember that when I was in the ICU, people would come. I mean, I was in the ICU in our hospital, so lots of people kind of coming through. But I will never forget my dear friend and colleague who's Ethiopian. She's an emergency department physician. She came in, and she gave me a foot massage. She didn't say a word.
Mhm.
And let me tell you, that was the most healing thing that I experienced. Because she was very slow. And, you know, that's another thing. Try to move slowly, because even just the movement and the energy takes a lot of energy to observe. So she was very slow. She was speaking softly when she came in. Everything was very gentle. And I so appreciated that treatment.
Okay.
Well, we are here as we're coming to the end of our hour here with Dr. K. There's a question that got snuck in right underneath the wire here, and this is from somebody's watching on YouTube. Question: now that we have CRISPR technology, how long do you think it can be perfected? Do you think it'll take to be perfected in regards to curing cancer? I'll put it on. I'll put it on the screen.
Yeah, you know, part of the problem with why mammograms are imperfect is because you're taking a three-dimensional structure, which is a gland, and trying to take two-dimensional pictures. So believe it or not, when you go through menopause and the breast becomes replaced with fat, it's actually easier to see abnormalities in women who've gone through menopause. If you were to look at a mammogram done on a young woman, it's very difficult to read.
Yeah.
And that's why mammograms are best when they are being compared to each other over time. So I think that there are technologies, and Dr. K, you want to speak to some of those?
Well, again, I think that we're becoming more, the MRIs are actually becoming more specific. But we do have to remember now, the best technology is not going to replace finding better chemotherapy drugs. And as I look at the research, finding out why with triple negative breast cancer, chemotherapy drugs actually can become resistant. The cells can actually become resistant to the chemotherapy. And that is oftentimes why after 3 years out, all of a sudden the drugs are not working. So, you know, we have two conversations. Can we make an accurate diagnosis? And then if we have the diagnosis of cancer, can we give the woman the right treatment for her disease? And I do want to end on the fact that all breast cancer is different and it is specific for your body. And so you do have to work closely with your oncologist to find the treatment that is going to be working for you.
The only thing I would add to that is participate in clinical trials. We need to get more people of color to participate in clinical trials so they can develop better medications, so they can become more effective. And so that participation is paramount to creating better treatments and better medications. So if there's a clinical trial that you participate in, do that. It can save a life.
And by the way, not all clinical trials are medications.
Right.
So they may have you enrolled in a clinical trial where you're at high risk for breast cancer, and they may be testing a new imaging technique.
That's right. Like
that is, you know, so exactly. So it's not always treatment. It's also could be for prevention. It could be for diet. It could be for diagnosis. And you know, I'm in a clinical trial right now because of the kidney cancer I had a year ago. Let me tell you, it is so nice to walk in and not worry about referrals or bills and get the best treatment in the country and get monitored. So that's what I love about clinical trials.
Well, Dr. K, this has been an honor. This has been an honor to meet you. You are a special person. I guess we'll call you Special K from now on. You're going to be Special K. You're going to be Special K. Plus, we get nicknames here on House Call with Dr. Gigi. She's been Auntie Gigi since the second week, and now we got Auntie Gigi and Special K. And I want to thank everybody that was watching. Your comments. So, Dr. K, if you get a chance, go and read the comments. They are so encouraging. They're so inspiring. People at their struggles, sharing their fight. I've been empowered by what they're writing. I've been empowered by what you have been teaching us tonight. Dr. Gigi, it's always a pleasure to do this show with you, and we look forward to seeing you both soon. Dr. K, you're a member now. You're part of the family, so we got to have you back.
It's things to do. We have some more. So thank you so much, and thank you. I'm humbled.
All right.
God bless.
Y'all have a great evening.
Bye-bye.
Good night.
Good night.